Hi, I'm Dr. Keith Darrow, neuroscientist and certified dementia practitioner. Most people think of cataracts as simply cloudy lenses in the eye, something that makes it harder to read, to drive at night, or to see the faces of loved ones. And lots of people see cataracts as a normal part of aging. And I'm here to tell you, there's nothing normal about experiencing cataracts, and that leaving them untreated can have profound consequences. While cataracts certainly affect vision, what many people don't realize is just how much cataracts also impact the brain. Untreated vision loss isn't just a nuisance, it's a major risk factor for cognitive decline and even dementia. But here's the good news. By treating cataracts, we're not only restoring sight, we're protecting brain health, emotional well-being, and your independence. Today, I want to share with you the 5 medical benefits of treating cataracts, with a special focus on how it can protect the mind as we age. Let's start with the first benefit: sharper vision and stronger brain engagement. The first and most immediate benefit of cataract treatment, of course, is improved vision. But sharper eyesight does much more than brighten colors and sharpen details. It re-engages the brain. When the eyes are clouded by cataracts, the brain receives weaker and distorted signals, forcing it to work harder to make sense of the world around you. Over time, this neural strain can accelerate cognitive fatigue and decline. By restoring clear visual input, cataract surgery gives the brain high-quality information again, keeping neural circuits active, engaged, and healthy. Okay, next, benefit number 2, the reduced risk of dementia and cognitive decline. This is perhaps the most powerful and meaningful medical benefit. Multiple studies now show that untreated vision loss, including cataracts, is one of the biggest modifiable risk factors for cognitive decline and dementia. In fact, when cataracts are treated, the risk of cognitive decline drops significantly. And the reason is really simple. The brain is a use it or lose it organ. When sensory input is blocked or degraded, the brain's network will weaken. But when vision is restored, the brain stays stimulated and resilient and active. Treating cataracts isn't just about seeing better, it's about thinking better, remembering more clearly, and protecting long-term cognitive health. All right, moving on to the third benefit of treating cataracts: fewer falls and greater independence. Yeah, I'm sure this one has your attention. Vision, cognition, and your mobility are all deeply linked. Falls in older adults often lead to hospitalization, loss of independence, and in some cases, accelerated cognitive decline. Blurred vision from cataracts can make falls far more likely by impairing depth perception and balance. But after cataract surgery, patients regain visual clarity and mobility confidence, which dramatically lowers the risk of falls and fall-related injuries. And by preventing falls, we protect not only the body, but we also protect the brain, since injuries and hospitalizations are well-known accelerators of decline. Okay, benefit number 4, improved emotional and mental health. When vision fades, so too can emotional health. People with untreated cataracts are more likely to withdraw from social activities, struggle with depression, and experience anxiety. I saw this firsthand with my grandmother, and I'm sure you've seen it too in loved ones. The social isolation that comes with vision impairment can be disabling, and social isolation is a known risk factor for cognitive decline. Cataract treatment helps restore not only vision, but also the joy of connection, seeing faces, reading expressions, and engaging with the people and the world around you. This renewed engagement It protects emotional well-being and strengthens the brain through meaningful social interactions. Okay, last and certainly not least, benefit number 5 is all about better management of overall health. Simply put, clearer vision helps people take better care of themselves. Whether it's reading medication labels correctly, checking blood sugar, or following doctor's instructions, good vision is essential for managing chronic conditions like diabetes, heart disease, hearing loss, tinnitus. And better management of these conditions reduces inflammation and vascular risk, two pathways that are strongly linked to dementia. In other words, cataract treatment indirectly supports brain health by making it easier to stay on top of the rest of your health. So while most people think of treating cataracts as simply fixing vision, the reality is far greater. By treating cataracts, we are protecting the brain, lowering dementia risk, preventing falls, improving mood, and giving people the tools to live longer, healthier, more independent lives. Cataracts cloud more than just the lens of the eye. They cloud the brain's ability to thrive. Treatment lifts that cloud. And when restored sight, we restore life. Thank you for spending these few minutes with me. If you or someone you love is living with cataracts, don't delay treatment. The benefits are clear, not just for your eyes, but for your brain and for your future.